The medical malpractice case I found involves an Atlanta-based dermatologist who has been sued 5 times by women claiming medical malpractice, saying she was negligent in their care. One of the women suffered permanent brain damage. Dr. Wendy Boutte posted videos on her YouTube channel of herself and her assistants singing and dancing to music while performing cosmetic surgeries, including liposuction. Some of the women said they could identify themselves in the videos. One lawsuit claims Dr. Boutte posted the video of her body without her permission. This woman also states she was left with permanent scars after treatment. The woman who suffered brain damage experienced a lack of oxygen in combination with her heart stopping after 8 hours of surgery. She now requires 24-hour care. 4 of the cases have reached settlements, however, the amounts have been kept confidential. As of July 2018, Dr. Boutte reached a settlement with the Georgia Medical Board to give up her license for 2.5 years. In this specific medical malpractice case, I absolutely think it is fair that this healthcare provider be held accountable to her patients that did not receive their intended results. According to the textbook, the very definition of malpractice is the improper and negligent conduct that causes injury to patients for which providers of healthcare may be sued. Dr. Boutte was negligent in her conduct during surgery. As a result, one patient developed permanent brain damage while others developed infections and were left with scars. She also violated her patient's privacy by posting these videos onto YouTube, which is a public site. Under normal circumstances, I do believe that a patient should share some level of responsibility for the outcome of a high-risk medical procedure. Anytime you are put under, there is always a risk for adverse events or serious reportable events. It is important in these situations to have informed consent from the patient because this means that the patient has discussed with the physician any possible risks. However, in this case, Dr. Boutte's patients were not aware that she treated her operating room as a nightclub. There are a lot of factors that could have been altered so that the medical malpractice suits against Dr. Boutte did not occur. First and most importantly, she should not have filmed her procedures and posted them on a public social media site. Secondly, she should not have acted negligently by singing and dancing while performing the surgeries. In my opinion, she was essentially making a mockery out of her patients. Along with her education and credentials, Dr. Boutte portrayed herself in a truthful manner that made these women trust her medical opinion. They did not sign up for what happened to them afterwards. I do not think suspending Dr. Boutte's medical license for 2.5 years is punishment enough. She should lose her license permanently and never be allowed to practice medicine again. It is not fair that these women suffered serious complications and injury at the expense of a doctor who did not take more caution and pride in the medical care she put forth.